Public health officials believe that what's driving this most recent surge in coronavirus cases is the occasions where people let their guard down: dinner parties, carpools, sleepovers. We've been concentrating on bars and restaurants, but it may be much closer to home, which isn't a good thing with the holidays on the horizon. Along with bars and restaurants, blame was being heaped on nursing homes. But public health officials say their probes of new cases are leading them to small, private gatherings. The White House Coronavirus Task Force has been urging people to avoid known virus hotspots and to hold off on get-togethers without masks between family and friends. They noted that asymptomatic people attending the gatherings cause ongoing transmission, frequently infecting multiple people in a single gathering. Thursday was certainly a devastating day with the numbers. There were 152,391 new cases of the virus, with 66,606 people hospitalized. Chicago's Mayor Lori Lightfoot told her city's residents that starting Monday, they should only leave home to go to work, school, or for essential needs. New York Governor Andrew Cuomo, D., put a 10-person limit on gatherings inside private homes, referring to those occasions as great spreader. Ohio, Utah, Connecticut, and Colorado have imposed similar restrictions. Colorado saw 7 people infected after a bunco gathering. Earlier in the outbreak, much of the growth in new daily cases was being driven by focal outbreaks, long-term care facilities, things of that nature, said Director Nirav Shah of the Center for Disease Control and Prevention in Maine. Now, the kitchen table is a place of risk. In Maine and other states, investigators are seeing a new pattern: people who are infected list more close contacts than they did earlier in the pandemic. This makes it harder for contact tracers to do their job. We've all gotten used to our bubbles, but I don't think we've really asked whether someone who's in our bubble is also in another person's bubble, said Shah. People's bubbles are getting big enough to burst. Each additional contact increases a person's risk, said Director David Rubin of Policy Lab at Children's Hospital of Philadelphia. In a blog post last week, the hospital warned that small, indoor gatherings create perfect conditions for a virus that can spread among people who are crowded into a poorly ventilated space. Rubin contends a person's bank of risk should be even lower in winter because respiratory viruses, like COVID-19, are more stable in the dry, colder air of the winter months. Often, they're with people we know really well, he said of the small gatherings.